I'm muted. Isn't that great? Welcome, everyone, to supporting patient and client self advocacy today. If you are catching this live, please put a hashtag live in the chat. If you are catching this on the replay, go ahead and put a hashtag replay. Feel free to put your questions in the comments or in the chat, or send me hearts, or just let me know that you're here and that you're listening. I'm really excited to be present for this today. So, we are going to be talking about supporting patient and client self advocacy, specifically what this looks like when we're supporting patient and client self advocacy for our gender expansive patients and clients, because we're entering a time where it might feel really scary. And there's a lot of folks who are having a lot of challenges with advocating for their health needs. And so this is an opportunity for us to talk in depth around what that can actually look like. So stay tuned. We're going to talk about how you can be a supportive staff member if you're doing case management, if you are a healthcare provider, if you are a public health professional to your patients and clients, and how you can support their self advocacy. All right, welcome to Ask Miss Jai. My name is Miss Jai. I am the host of Ask Miss Jai Live. I use she, her, and he, him pronouns. A little bit about me and why I'm talking about supporting patient and client self-advocacy. In a previous life, I worked in HIV prevention and HIV care, and I worked as a case manager for folks who are living with HIV, and then ran a case management program for folks who are living with HIV within a clinical setting. So a lot of what we discussed and a lot of what we worked on was how to support our patients and our clients in being able to advocate for their health needs in healthcare settings and in public health settings, especially when we weren't around. And the reason I'm talking about this through Ask Ms. Jai Live is because we find that for trans and non-binary folks, for gender expansive folks, there can be a lot of challenges with engaging with the healthcare system, challenges with engaging with public health and getting our health needs met. And oftentimes that results in needing support around learning how to be our own advocates in those environments. So I'm really excited to be able to provide this information to you all today. If you have any questions, feel free to put them in the comments. If you have anything that this brings up for you or any thoughts on how this can be applied to your work, feel free to share that in the comments as well. It might spark some ideas for other folks who are listening to this. So what we're going to start with first is talking about what is self-advocacy. So self-advocacy is the ability to speak on one's behalf and represent personal needs and interests. And in the context of healthcare and public health or health services, social services, etc., it's the ability for us to speak up on our own behalf and represent what we need in those environments in order to maximize our health potential or maximize the health service that we are trying to get access to. And so I'm going to give you 4 tips and with some examples on how you can be an effective support person in the professional sense for folks who you are trying to educate or teach how to self-advocate in healthcare and public health environments. The first tip that I have for you is you want to focus on skills building with the patient or client that you're working with. So that skills building can look like a variety of things. There's a lot of ways that folks can build skill around self-advocacy. So identifying what that can look like is going to be unique to each of your patients or clients. And the first thing that I generally like to do with a new patient or with a new client is do sort of an inventory of strengths. What are things that have worked well for them in the past? What has helped them to advocate for themselves or helped them to prepare to advocate for themselves? What are some opportunities? So where do they know that they struggle? Where do they know that it becomes more difficult for them to advocate? Are they more likely to speak up when they're talking to someone like you who might be a patient care navigator or a social worker versus when they're speaking to a physician or a clinician? Are they more likely to speak up when they are talking to the clinician or physician, but then if they have issues at the pharmacy, they're less likely to speak up? So identify where some of those opportunities are, and then identify what the need is in that opportunity. And part of that is figuring out like what the right is, right? So if someone has the opportunity that they're having trouble speaking up at the pharmacy when there's an issue with their medication, then what is the need around that? Is the need that they need to do some additional preparation ahead of time? Is the need that they need to sort of understand what their rights are at the pharmacy to ask the pharmacist to verify a medication or verify a prior authorization, et cetera? Or is the need that they need to bring someone with them to help advocate with them? So looking at it, doing an inventory of the strengths, the opportunities, and the needs in those opportunities. Some other skills building pieces can also be how to prepare for a visit meeting. So that could be things like bringing medication lists, bringing pre-written questions, prioritizing what is most important to them since there's a finite amount of time. It could look like having them practice taking notes on instructions. So sitting with them and saying, here are the instructions for our next meeting together. I'm going to have you practice taking these notes so we can talk about it. It could be explaining health literacy topics and having them summarize those topics back to you, or be modeling how to be accountable. So, for example, when we're working with trans and non-binary folks, there's a lot of fear sometimes that we're going to make a mistake or that we are going to say something inaccurate or incorrectly. And one of the ways that we can help other folks build skills is by modeling how to navigate when a mistake is made. And so if you are needing some support on on how to better serve trans and non-binary folks, I've just launched a course for healthcare providers on how to, like, on the foundations of trans and non-binary patient care, which helps to give you some of those tips and tools for addressing and working with trans and non-binary patients. So I'll make sure that that's included in the comments and in the notes for this live once we conclude. So focusing on skills building is the first tip that I have for you in terms of helping patients and clients build their self advocacy skills. The second tip that I'm going to give for you is to do with our clients or patients, not doing for our clients and patients. And this comes up, and this is a trap that I have fallen into as a case manager, as someone who's run a case management program as well, is the fact that systems are confusing, and that because systems are confusing, I would make the assumption that they're confusing for everybody. And as a result of that, I would sometimes overstep or overdo for patients and clients in ways and in activities and in engagement that they are fully capable of doing for themselves as well. So the first piece of this with doing with and not for is remembering that even though systems are confusing, not everyone is confused by all aspects of the system. And that means we have to work with our patients or clients to complete tasks instead of just completing the tasks for them. So, for example, if a patient or a client is needing to schedule an appointment, then working with the patient or client might be helping them to find the number for scheduling that appointment or being with them when they call to schedule that appointment. Working for the patient or client would be taking over control of that and calling and scheduling that appointment on their behalf. And we know that sometimes when we are working with some patients and clients, they require that level of support. But we want to check in with our patient and client instead of just doing it on their behalf. And a part of that is avoiding taking over or bulldozing the needs of that person that we're working with. So it can look like things like we for example, I was working with a client who was needing behavioral health services and wasn't sure where to even start looking for behavioral health services, which insurance, which were covered by their insurance, how much it would be, et cetera. And so we worked together. We sat down at my computer and we pulled up the list of providers that were within network for the client. And then we talked about what being in network meant versus being out of network. So a little bit of that health literacy and understanding kind of what was going on. And then once we were able to look at this list, it was a list of maybe 30 providers. There was a lot of anxiousness from the client around whether, like, taking the next steps of calling and scheduling an appointment and doing those pieces. And so instead of me just bulldozing and saying, well, I'll just call folks and I'll schedule an appointment for you, we came up with a plan. And what that plan looked like was I asked them how many they felt like they could comfortably call or call before they got overwhelmed. And they said, I can call 5 before I get overwhelmed. And so I said, okay, you call the first 5, and then let's touch base and you tell me how that went. And if you need me to help you then call the next 5, then I can call with you for the next 5. And then you can call on your own the 5 after that. So it's helping folks to understand that there is, um, that they have control over the situation and that they need to be engaged with what's going on, that I can't just do it for them. That ultimately our patients or our clients need to be engaged in the action steps because this is ultimately about their health and well being. The third tip that I have for you is to teach beyond your position. And what I mean by this is that depending on your patient or client, they may need the service that you are providing for longer than you are in the position to provide that service. Um, for example, I worked as a case manager and then was doing direct service case management and then moved into a managerial position and was overseeing a case management program. When I made that shift, my caseload shrunk, which means that folks who had been working with me previously were delegated new case managers and connected to new case managers to provide support, but they had become familiar with the ways that I provide case management support. So if in that instance, I'm still around, but I'm no longer able to give direct support to the person. When I left the organization, I no longer was working with any of the clients that I had been previously working with. And so those patients were reassigned to new case managers and had to develop new rapport and new working relationships with new case managers. When we teach beyond our position, we are preparing our client or our patient to take the reins on their health activities, on their action plan for their health, right? So we're preparing the client or the patient to be able to take the reins and move with whatever their plan is to get their health needs met. So again, in doing that original inventory of strengths, opportunities, and needs, we identified what some of those needs are. And clients are now aware of that. We're now preparing them to take the reins and move forward with that. And so, what that can look like is when I was actively engaged with the client or the patient, and I was working in the environment, I was working in a healthcare environment. So the patient, I would ask them questions to sort of get an understanding of where they were at and how they understood the next steps for addressing challenges as they came up, or the next steps for taking steps in their action plan or their healthcare plan would look like for them. And so, what the questions that I would ask were things like, what do you think is the first thing you need to do in this situation? So, if I have a patient who is coming to me and they're saying, I tried signing up or engaging, seeing a primary care provider for the first time, and I went, and the first thing that happened was that I was misgendered and I was misnamed. And so I left the doctor's office. Then I might ask them, what do you think is the first step that you need to do in this situation? Right? What's the first step that you are needing in order to still get your health needs met? Maybe it's scheduling with a new primary care provider. Maybe it is filing a grievance with the office that they scheduled with you originally. Maybe it is calling the office they scheduled originally with and explaining what has occurred and trying to reschedule an appointment at that office. But because I don't want to take autonomy away from the patient that I'm working with, I don't want to assume that the next step for them is the next step that I would take. So I want to make sure that I'm giving folks the opportunity to sort of critically think about, how do I solve this for myself so I am still getting my needs met? I might also ask something like, how would you like me to support you in these next steps? So if the client says to me, I just want to get a new doctor, I don't want to go back to that doctor's office at all, which is a legitimate response when we are treated poorly in an environment, right? So if they say, I just don't want to go to that doctor's office, I want to go to a new doctor's office, then again, before I jump into, this is how I can do that for you, I'm going to ask the client or the patient, how would you like me to support you in the next steps? So, how would you like me to support you in finding a new doctor or scheduling a new appointment with a new doctor? And they might just say, I actually don't need your help. I already have that list that we have collected together. Or they might say, do you know any doctors? Right. And so then I might lean on the referrals that I am aware of, or the vetted providers that I already know are affirming to provide uh, to my client or my patient at that time, right? But I don't want to take over autonomy. I want to make sure that they to direct how they would like me to support them in this. And then I will also ask sometimes to patients or clients who are starting to feel a little bit stuck, who could you reach out to for support if I wasn't here to help you with this? I want to make sure that if I'm unavailable for some reason, if I am out of the office because I'm on vacation, or I'm on paternity leave, uh, or I'm out sick one day, right? That they are already thinking about the network of support that they have, that their support goes beyond just me as an individual. But this also helps to prepare the patient or client for the future as well, so that they are aware that they have other folks that they can lean on, whether that be other folks within the office, other providers, other social service workers, friends, family, right? It expands that network of support. There are ways that we can teach beyond our position. We can go beyond just, I am the sole person who can help you. And this helps to build self advocacy. It also helps to build resilience when there are issues that occur. The final tip that I have for you today is to be consistent even when it's hard when it comes to supporting patient and client self advocacy. And what I mean by this is that mistakes are part of the learning process. And this is no different for folks who are learning how to self advocate. So if you are supporting a patient or client who is learning how to advocate for themselves in healthcare or public health environments, or social service situations like shelters or food services, etc., that mistakes are going to happen. Folks might get upset. They might flash or yell at a provider. They might get frustrated with the process. They might get frustrated with you. They may drop the ball for themselves, right? They might not call any folks to schedule the appointment. They might have blocks around being placed in a shelter service or being placed in housing support. So they may do things that result in them being exited out of those, right? So mistakes are part of this learning process. And if we go back to that, identifying the strengths, the opportunities, and the needs, it helps us to see, okay, well, a mistake was made here that resulted in X, Y, or Z. Let's go back to what went well this time round. Let's go back to what didn't go well this time round that you would like to have go differently in the future. And let's go back to where your needs met, or were they not met. I worked with a client once who was a young LGBTQ person who we had worked really hard to get enrolled in housing support. And within 2 weeks of being in, and had been chronically homeless most of their life. And within 2 weeks of being in a housing environment, they just left the apartment. They said, I can't stay here anymore. It's too quiet. The walls are really intense, and they just left the situation. In that moment, it felt really difficult as the professional who had worked really hard behind the scenes in order to get this to come to fruition. But it wasn't about me in that moment, and I needed to be consistent in how I was supporting. And so instead, we sat down and we discussed what worked well, what didn't work well. So maybe an apartment like this is not a good fit for you, or an apartment that feels isolated from community is not a good fit for you. And then what do you actually need moving forward? So we want to make sure that we are understanding that making mistakes or shifting in the plan can be part of this as we are in trying to be consistent. We also need to avoid personalizing frustration with the system. So in general, I've worked in public health and I've worked in healthcare all of my career. And they're two oftentimes very large bureaucratic systems that result in a lot of red tape, a lot of challenges with getting things completed. Sometimes there are changes in processes or in policy that we are not made aware of. And so when something was done one way, one day, It's no longer done that way, and it can feel very frustrating and very overwhelming as a professional. That frustration and overwhelm is also something that is experienced by our patients and clients. It might be, well, previously I was able to show you this kind of documentation and it was appropriate for me to get enrolled in this program. Now I'm not able to show you that documentation, or you're telling me it's not valid. So folks are going to get frustrated with the system. And oftentimes we end up being the listening ear for that frustration because we are the person who is providing the most face time and support to our patients and our clients. And so we can't personalize those frustrations with the system because we'll start to become frustrated with the patient or the client as a result of it. So we have to depersonalize that and recognize that, yes, the system is frustrating. I'm here to help you navigate it the best I can. So let's work together, again, work with instead of for. Let's work together so we can try and navigate this the best that we can. This also helps us when we are trying to avoid working for, because if we say to someone, okay, I've submitted all of your paperwork, everything is set up, you're good to go. If there is a hitch, if there is an issue that comes up, then suddenly we become the focal point for that. Like I'm not doing, I get blamed for not doing my job when I've done everything to the best of my knowledge and expertise in supporting this person, and a hitch has occurred. So we want to work with the person, but not personalize those frustrations with the system. We also want to recognize that resiliency can shift over time. So sometimes you may need to support more, and sometimes you might need to support less. So checking in with folks around how things are feeling. Someone who was able to call and schedule an appointment for an x ray for themselves in the past might be in a place right now where they're just like, if this is one more thing on my list, and I really just don't have the time, the energy, the mental capacity to do it. Can you help me with it? So we don't want to assume that folks are who have been able to do things in the past are able to do them now. Just like we don't want to assume that because something was difficult in the past that someone isn't able to take it on now an action step or as an engaged participant in it. Resiliency shifts over time. For example, for myself, the wintertime is very difficult. As it becomes darker, it's harder for me to get up in the morning. It's harder for me to stay focused at work. It's harder for me to navigate additional responsibilities. And so it can become very difficult for me to take on, okay, well, now I need to schedule an appointment for myself. Now I need to call back this person. Now I need to find this documentation in a list in a filing cabinet full of documentation. So knowing that about myself, and letting my anyone who's supporting me know that can help them to be able to support me in those moments. Our patients and our clients may not know that it's okay for them to ask for that. So build that into the ways that you are supporting that self advocacy of, if this becomes difficult in the future, let me know. I'm happy to work with you on it. Or I helped you with scheduling this now. Next time, I would like us to talk about you scheduling it on your own so you can become comfortable with the process. And then finally, when it comes to being consistent, even when it's hard, I encourage you to learn and practice de escalation techniques so that when and if folks do become escalated, they do become frustrated, you are able to have some tools in your back pocket to help calm a situation down. Depending on who you're working with and depending on the context for your work, it can be helpful to have a couple of tools already set that you know are effective to de-escalate. So that could be things like when folks start to get agitated or upset or start to yell, lowering your tone of voice, starting to speak softer, making sure you're not blocking a door for exit or entry, making sure that you are maybe sitting down as opposed to standing up or over a person. So practicing some of these de-escalation techniques can be helpful to support you in being consistent around self advocacy, even when it's a difficult situation. So, I hope that these tips have been helpful for you on ways that you can support patient and client self advocacy in healthcare and public health environments. Again, these are sort of general tips, but a lot of them apply to the ways that we support gender expansive folks, trans and non binary people specifically. And we know that because of the experiences of trans and non-binary folks in medical settings, because of the distrust and mistrust of medical professionals, it can already feel like there's a lot of insurmountable barriers for trans and non-binary people to be addressing just to get some of these basic health needs met. So I hope that this gives you a starting point and some of the practical ways that you can start to address self-advocacy with your trans and non-binary patients and clients. Again, my name is Miss Jai. I use she, her, and he, him pronouns. I am the founder and CEO of Ask Miss Jai, and I am your host for Ask Miss Jai Live. We are in season 4, which is very exciting. So if you haven't had a chance to check out previous episodes, please check them out on our YouTube channel. Please like and subscribe to the YouTube channel as well if you'd like to get regular updates for those episodes. And you can also check out on our YouTube channel the collaboration with the CDC. We just launched the first season of the Social Determinants of Health series, which focuses on social determinants of health for trans and non-binary communities. It's also the first ever CDC YouTube series. So that's very exciting work that we are doing. For more information, you can also check us out on our website at www.askmissjai.com. And yeah, that's kind of who we are. If you liked this, please let me know in the comments. If you have additional questions, please let me know in the comments. And as always, thank you for taking the time to invest in the health and well-being of trans and non-binary people. Until next time, take care.